Understanding Antisocial Personality Disorder, ASPD. Antisocial Personality Disorder, ASPD, is a chronic mental health condition characterized by a long-term pattern of manipulating, exploiting, or violating the rights of others. This behavior is often criminal. The condition is sometimes referred to as sociopathy or psychopathy, though these terms have different meanings in various contexts. Diagnostic criteria and symptoms. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, outlines the criteria for diagnosing ASPD. To receive a diagnosis, an individual must exhibit a pervasive pattern of disregard for and violation of the rights of others since the age of 15. The individual must meet at least 3 of the following criteria. 1. Repeatedly breaking the law, engaging in acts that are grounds for arrest. 2. Deceitfulness, lying, using aliases, or conning others for personal profit or pleasure. 3. Impulsivity or failure to plan, acting without forethought or consideration of consequences. 4. Irritability and aggressiveness, repeated physical fights or assaults. 5. Reckless disregard for safety, engaging in activities that put oneself or others at risk. 6. Consistent irresponsibility, failure to sustain consistent work behavior or honor financial obligations. 7. Lack of remorse, indifference to or rationalization of having hurt, mistreated, or stolen from another. Additionally, the individual must be at least 18 years old, and there must be evidence of conduct disorder with onset before age 15. Conduct disorder involves a repetitive and persistent pattern of behavior where the basic rights of others or major age-appropriate societal norms or rules are violated. Causes and risk factors. The development of ASPD is influenced by a complex interplay of genetic, environmental, and psychological factors. Key risk factors include 1. Genetics. There is evidence to suggest a hereditary component to ASPD. Individuals with a family history of the disorder or other personality disorders are at a higher risk. 2. Brain structure and function. Studies have shown abnormalities in the prefrontal cortex and other areas of the brain involved in decision-making, impulse control, and emotional regulation. 3. Environmental factors. Childhood abuse, neglect, unstable family life, and exposure to violence or criminal behavior can contribute to the development of ASPD. 4. Psychosocial factors. Early childhood behavioral problems, such as conduct disorder, are strong predictors of later ASPD. Personal anecdote. A glimpse into life with ASPD. To better understand the human aspect of ASPD, consider the story of Mark, name changed for privacy, who was diagnosed with ASPD in his early 20s. Mark grew up in a tumultuous household with frequent episodes of domestic violence. From a young age, he exhibited aggressive behavior, stealing from his peers and lying to authority figures. As he entered adolescence, his behavior escalated. Mark became involved in petty crimes and developed a reputation for his manipulative and deceitful nature. Despite several run-ins with the law, he showed no remorse for his actions. It wasn't until he was mandated to undergo a psychological evaluation that Mark received his diagnosis. Mark's story highlights the profound impact of early environmental influences and the challenges individuals with ASPD face in forming meaningful, empathetic relationships. Despite his diagnosis, Mark has been working with a therapist to manage his condition and reduce the harmful behaviors associated with ASPD. Treatment and management. Managing ASPD can be challenging due to the inherent traits of the disorder, such as deceitfulness and lack of remorse. However, several approaches can help mitigate the symptoms and improve the quality of life for individuals with ASPD. 1. Psychotherapy. Cognitive behavioral therapy, CBT, is often used to help individuals recognize and change harmful thought patterns and behaviors. Therapy focuses on developing coping mechanisms, improving impulse control, and fostering empathy. 2. Medication. While there is no specific medication for ASPD, certain medications may be prescribed to address co-occurring conditions such as depression, anxiety, or aggression. These can include antidepressants, antipsychotics, or mood stabilizers. 3. Behavioral interventions. Structured environments, such as residential treatment programs, can provide stability and reduce opportunities for harmful behavior. These programs often include a combination of therapy, education, and vocational training. 4. Support networks. Building a support network of family, friends, and professionals can provide the necessary encouragement and accountability for individuals with ASPD to stay on track with their treatment plans. The impact on relationships and society. ASPD can have a profound impact on relationships and society. Individuals with ASPD often struggle to form genuine, trusting relationships due to their manipulative and deceitful nature. This can lead to a cycle of broken relationships, job instability, and legal issues. Family members of individuals with ASPD often experience significant stress and emotional turmoil. They may feel helpless or frustrated by the individual's behavior and the lack of remorse or accountability. Support groups and therapy for family members can provide much-needed relief and coping strategies. On a societal level, individuals with ASPD are overrepresented in the criminal justice system. Their actions can result in significant economic costs related to law enforcement, legal proceedings, and incarceration. Additionally, their behavior can cause emotional and psychological harm to victims. Personal anecdote. Navigating relationships with ASPD. Consider the experience of Jenny, who was in a relationship with an individual with ASPD. Initially, her partner, Tom, was charming and attentive, but over time, his manipulative and deceitful behavior became apparent. Tom often lied about his whereabouts, manipulated Jenny into giving him money, and showed little regard for her feelings. Despite several attempts to address these issues, Tom's behavior remained unchanged. Jenny eventually sought therapy, where she learned about ASPD and how to set boundaries to protect herself emotionally and financially. Jenny's story underscores the importance of education and support for those in relationships with individuals with ASPD. Prognosis and future directions. The prognosis for individuals with ASPD varies widely. Some individuals may see a reduction in symptoms with age and effective treatment, while others may continue to exhibit harmful behaviors throughout their lives. Early intervention and comprehensive treatment can improve outcomes and reduce the impact on individuals and society. Ongoing research is essential to better understand the underlying causes of ASPD and develop more effective treatment strategies. Advances in neuroscience, genetics, and psychology hold promise for improving the diagnosis, treatment, and management of ASPD. Antisocial Personality Disorder is a complex and challenging mental health condition that affects individuals, families, and society at large. Understanding the diagnostic criteria, causes, and treatment options is crucial for managing the disorder and supporting those affected by it. Through continued research and compassionate care, it is possible to mitigate the impact of ASPD and improve the lives of those living with the disorder. Whether you are a mental health professional, a family member, or someone seeking to understand ASPD, it is important to approach the topic with empathy and a commitment to learning. By doing so, we can create a more supportive and informed society that better addresses the needs of individuals with ASPD. If you found value in this video, please give it a thumbs up, like and subscribe to support this channel. Please share across social media platforms to reach a wider audience. Individuals with Antisocial Personality Disorder, ASPD, face significant challenges in forming genuine, trusting relationships due to the core characteristics of the disorder. These challenges include 1. Lack of empathy. Individuals with ASPD often have a limited ability to understand or share the feelings of others, which makes it difficult for them to relate to others on an emotional level. This lack of empathy can lead to a failure to recognize or respect the emotions and needs of others, resulting in superficial and one-sided relationships. Example: a person with ASPD might fail to console a friend who is going through a tough time, not out of malice, but because they genuinely do not understand or appreciate the friend's distress. 2. Manipulative behavior. People with ASPD tend to use deceit and manipulation to achieve their goals. This behavior undermines trust and fosters suspicion in relationships. Others may feel used or betrayed when they realize they have been manipulated, leading to broken relationships and a lack of trust in the individual with ASPD. Example: borrowing money under pretenses or making promises they do not intend to keep are common manipulative tactics that erode trust. 3. Impulsivity and recklessness. Impulsive and reckless behavior can create instability in relationships. Individuals with ASPD may act without considering the consequences, often engaging in risky or harmful activities. This unpredictability makes it hard for others to feel secure or to rely on the person with ASPD, leading to strained or failed relationships. Example: engaging in criminal activities, substance abuse, or reckless driving can create an environment of fear and instability for loved ones. 4. Chronic lying. Persistent deceit and dishonesty are hallmarks of ASPD. Constant lying undermines the foundation of trust necessary for any healthy relationship. When others cannot trust what an individual with ASPD says, it becomes nearly impossible to build a genuine connection. Relationships often collapse under the weight of dishonesty. Example: repeatedly lying about significant aspects of their life, such as their job, finances, or past, prevents any real intimacy or understanding. 5. Lack of remorse. A significant characteristic of ASPD is a lack of remorse or guilt for harmful actions. This indifference can be profoundly alienating for others. Impact. When individuals with ASPD do not show regret or take responsibility for their actions, it can lead to feelings of hurt, anger, and abandonment in others. Example: if someone with ASPD cheats on their partner and shows no remorse or understanding of the pain they caused, it becomes incredibly difficult for the relationship to recover. 6. Irresponsibility. Consistent irresponsibility in work and personal obligations is common. This can include failure to honor commitments or maintain steady employment. Irresponsible behavior can lead to financial instability and a lack of reliability, creating stress and frustration for others involved in their lives. Example: frequently missing work, failing to pay bills, or not fulfilling promises like picking up children from school can erode trust and dependability. 7. Aggressiveness and irritability. Individuals with ASPD often exhibit irritability and aggressiveness, including frequent physical fights or verbal outbursts. This behavior creates a hostile environment, making it difficult for others to feel safe and valued in the relationship. Example: an individual with ASPD might react violently to minor disagreements, making conflict resolution difficult and fostering fear and resentment. Personal anecdote: the impact of ASPD on family relationships. Consider the story of Emily, whose brother Jake was diagnosed with ASPD. Growing up, Emily noticed that Jake often lied to their parents, stole money from her, and got into frequent fights at school. Despite multiple confrontations, Jake never showed remorse for his actions. As they grew older, Jake's behavior became more unpredictable and manipulative. He borrowed large sums of money from family members under false pretenses and never repaid them. Family gatherings became tense, as Jake's aggressive outbursts were a constant threat. Emily struggled with feelings of betrayal and sadness, as she yearned for a genuine relationship with her brother. She eventually sought therapy to cope with the emotional toll and to learn how to set boundaries. Emily's experience highlights the profound challenges that individuals with ASPD face in maintaining meaningful family relationships. Strategies to improve relationships. Despite these challenges, some strategies can help individuals with ASPD improve their relationships. 1. Therapy and counseling. Engaging in regular therapy, such as cognitive behavioral therapy, CBT, can help individuals with ASPD develop better impulse control, empathy, and interpersonal skills. 2. Medication. While there is no specific medication for ASPD, treating co-occurring conditions such as depression or anxiety can help reduce some of the symptoms that interfere with relationships. 3. Behavioral interventions. Structured environments that promote positive behavior, such as residential treatment programs, can provide the support needed to make lasting changes. 4. Education and support for loved ones. Providing education and support to family members and friends can help them understand ASPD and develop effective coping strategies. 5. Setting clear boundaries. Loved ones can set clear boundaries and consequences for harmful behavior, which can help protect their well-being and promote more respectful interactions. Forming genuine, trusting relationships is a significant challenge for individuals with ASPD due to their lack of empathy, manipulative behavior, impulsivity, chronic lying, lack of remorse, irresponsibility, and aggressiveness. These traits make it difficult to build and maintain the trust and emotional connection necessary for healthy relationships. However, with appropriate treatment, support, and effort, individuals with ASPD can work towards improving their relationship skills. Therapy, medication, structured environments, and education for loved ones are crucial components in managing ASPD and fostering more positive and genuine relationships. Understanding and addressing these challenges with empathy and commitment can lead to better outcomes for individuals with ASPD and those who care about them. If you enjoy this video, please give it a thumbs up, like and subscribe to our channel for more self-improvement videos. Comment below to tell us how useful you found this video. Remember to share on various social media platforms to reach a wider audience. Click the notification bell to get notified anytime we post a new video. Thanks for watching, see you in the next video.